It is time now for Morning Rounds. Joining us are CBS News contributors Dr. Holly Phillips and Dr. Tara Narula. First up this week, the Centers for Disease Control says the Ebola outbreak is likely to spread to more countries. A third American aid worker has contracted the virus. Dr. Rick Sacra was delivering babies in Liberia when he became infected. He's being treated at a hospital now in Omaha, Nebraska. Ebola survivor Nancy Wrightbull talked for the first time this week about her near-death ordeal and recovery. At first, she tested positive for malaria. She was tested again and got the news that it was Ebola.
The darkest moment was the night they put me on the airplane, not knowing whether I'd ever see my husband again, not knowing whether I would live on that flight.
Nancy Wrightbull was released from Atlanta's Emory University Hospital 2 weeks ago. She told us she felt near death when she was transported from Liberia to the U.S. in early August. She received the experimental drug, ZMapp.
Was it the ZMapp drug? Was it the supportive care? Or was it your faith? And my answer to that question is all of the above.
Wrightbull and a second American, Dr. Kent Brantley, were both infected while working in Ebola units. The third victim, Dr. Rick Sacra, flew to Africa to help after learning they had the disease. But he worked in a maternity ward, away from Ebola patients. SIM missionary president Bruce Johnson.
They check patients at our hospital before admittance for Ebola symptoms, and there is a strong possibility that the Ebola symptoms were masked.
Sacra is one of roughly 200 American aid workers in West Africa, and concern is growing over the safety of U.S. doctors and missionaries treating the outbreak.
How many people
that work for you have volunteered to go after learning what happened to Kent and Nancy?
Dr. Sacra and also the doctor that is flying right now back to Liberia.
Does it concern you that one of the two that volunteered was diagnosed? You're still actively encouraging them to go.
Obviously, it concerns us. It concerned Rick and his wife as they talked about him returning.
Holly, some health experts have criticized both the CDC and the World Health Organization for being reactive rather than proactive when it comes to this Ebola outbreak. Are we ready for the next outbreak?
You know, Jeff, in terms of preparedness, we're certainly learning a lot from this Ebola outbreak, and that'll affect how we, manage other epidemics. But really, when we look at it, time is of the essence here. This epidemic is being described as spiraling upward and out of control, and Ebola has its own unique set of challenges. You know, for one thing, it's gripping places where healthcare is virtually non-existent, and there are challenges to awareness and education. You know, we're seeing cases where people are hiding their family members who are sick with Ebola rather than putting them in isolation wards, which of course spreads illness. But also we need greater cooperation from the international community. We're seeing some countries that are neighboring places with Ebola closing down their borders, which paradoxically actually raises the risk of spread within their own countries and outside of it. So I do think we're learning a lot from the challenges that Ebola is facing us with, and we can apply those to the next situation.
Tara, we heard Jeff in the piece actually ask the missionary group, are you going to send people? Are you going to stop sending people? Are they starting to reevaluate sending more missionaries and aid groups over there?
I think the fact that a third aid worker got sick, raises that question. But these are people, as they said in the package, that are volunteering to go. These are really the heroes who are on the front line fighting this epidemic. And I think, if anything, what this has done is caused the aid groups to shout out to the world that they need help. They're overstretched. They don't have enough funds and healthcare workers on the ground and resources. And, it's a time for the global community to really step in, what they're saying, and make this a global problem, not just a problem that faces Africa. And, the head of the Doctors Without Borders this week said the clock is ticking and Ebola's winning. And I think that's really the statement that these aid groups are making, is that we need bigger help from the international community, just as Holly said.
Holly, the NIH has now begun human trials of an Ebola vaccine. Kent Brantley and Nancy Wrightbull received ZMapp, this experimental drug. Is it too late for both of those to make a difference in this now?
I do think meds and vaccines will play a role on some level, even in this epidemic. But right now, the focus has to be on what we have, which is isolation, quarantine, and just supportive care. Really, it's all about education and making people aware.
Also this week, a study in the Journal of the American Medical Association finds many women are having unnecessary double mastectomies. Their survival rate was nearly identical compared to women who chose lumpectomies plus radiation. The number of early-stage breast cancer patients who get a double mastectomy has grown substantially in recent years. This seems like a pretty major surgery to have if it is in fact unnecessary.
That's right, and I think it's important for people to understand what we're talking about. We're talking about early-stage breast cancer, and there's really three ways to treat that. One is the breast-conserving therapy, which is lumpectomy and radiation of the affected breast. Another is unilateral mastectomy, which is taking the breast that's affected with cancer, and the most aggressive step is really removal of both breasts. Now, prior research has shown that breast-conserving therapy has the same survival as a unilateral or one-sided mastectomy. What this new research adds is that when we look at the rates of survival for bilateral mastectomy, it's also the same. Where there is a survival benefit is really in women who have a genetic predisposition to breast cancer, who have the BRCA1 or 2 gene, or a strong family history.
Holly, why are so many women doing this? Why do you think so many are doing this when some say they don't need it?
Right. You know, Jeff, the women who do it actually say it's about peace of mind. You know, the sense of having survived breast cancer and then still needing to go for mammograms or screening of the other breast is off-putting to some people. And also some women say it's about a cosmetic effect. They feel they get a better result if they have an implant in both breasts rather than one natural breast and one reconstructed. The most important here is for women to know what they're getting and what they're not getting. And what you're not getting in most cases is a survival benefit.
So you may not be getting the survival benefit, but is there actually something negative you could be doing by getting that double mastectomy if you don't need it?
So there are risks to any surgical procedure. And for mastectomy, overall the risks are low. It's about 5%. But you have to imagine that when you're operating on one breast, you have the risk of infection, blood formation there under the skin, death of the flap of the tissue they use to cover the breast, a risk of fluid collections. And now when you operate on two breasts, you have two surgical sites. So you're doubling your risk there. And what most recent research has shown is that with bilateral mastectomy, you have increased rates of blood transfusion, increased rates of implant loss if you're reconstructed, and longer hospital stays. And this is not to mention the other risks that come from mastectomy, which have to do with sexual function and feelings of femininity and quality of life.
If you're trying to lose weight, a new study suggests cutting carbs is better than cutting fat. Researchers at Tulane studied 148 obese men and women for a year. The people who followed a low-carb diet lost significantly more weight and reduced their risk of heart problems compared to those who cut their fat intake.
Finally, more evidence that love is in fact good for your heart. The American Heart Association and the dating site Match.com asked 1,000 adults about their lifestyle habits. The results show that relationships can improve mental and physical activity. So, Tara, you were actually a spokesperson for the American Heart Association.
Yes.
Tell us about the survey.
I love being able to say love is good for the heart.
Yeah.
Makes sense.
This was a fun and sort of interesting survey that was sponsored by Match.com and put on by the American Heart Association. It's really the first time that they've partnered in this way. And what they did find, to many people's surprise, is that people who were paired up actually led healthier lives. They ate healthier more days of the week, they ate more fruits and vegetables, they had less salt and sugar in their diet, exercised more, had more sex, and overall reported healthier decisions.
Dare I say, it seems like a man might benefit a little bit more than a woman from all this.
No doubt about it. No doubt about it.
Right. Dr. Holly Phillips, Dr. Tara Narula, thank you both.
Thank you.